Welcome, champions, to another Nothing But Nets deep dive. We are joined today by a wonderful speaker. We are so excited to jump into our Frontlines conversation with Mirriam Banda. Mirriam is a primary healthcare provider, a midwife, a nurse, an administrator, a counselor, and a health champion at the Kafumbwe Rural Health Center in Katete District in Eastern Zambia. She is also a married mother of three, and in 2011, she faced one of the hardest challenges as her daughter fought malaria. Thankfully, she recovered. The memory still haunts her and her family and inspires Mirriam to do this amazing work in the fight against malaria in her community every day. Welcome, Mirriam, and thank you for joining us.
Thank you very much for having this opportunity to speak to Nothing But Nets. It is my pleasure that I'm a host to share my experience on malaria. Thank you.
Thank you, Mirriam. And for those of you who may be joining us for the first time, my name is Amma Boateng. I am the grassroots associate here with Nothing But Nets on our advocacy team. And today I have the pleasure of interviewing Mirriam, getting a better sense of the work that she does and why she, as a frontline worker, has dedicated her life to the fight against malaria. So my first question for you, Mirriam, is how did you first become involved with the work at the Kafumbwe Rural Center?
What inspired me to start the advocacy work at my clinic, that is at Kafumbwe Rural Health Center, or let me say for the whole community of Kafumbwe in Katete. I am a midwife by profession, and every day I meet different people of all walks of life. And looking at the area where I come from, it is a place that is, it's a rural setup whereby most of the people are illiterate, are not really educated to that level that you can say that they are educated. So it prompted me because most of these people don't have the voice. They can't voice out on what they really need for them not to get sick from malaria, or maybe to prevent themselves from getting malaria or maybe any other diseases. So it prompted me that I should be a voice for the voiceless and be for a voice for those people that are not educated. And then also another thing that really prompted me to go into advocacy was when my daughter, my firstborn daughter, Tamani, was sick with severe malaria. That was when she was 5 years old, of which I almost lost her to severe malaria. But luckily, due to the available diagnostics of malaria and also the treatments, my daughter was saved, and I still have her up to now. Thank you.
Thank you so much. And I wanted to ask a bit more, in that situation, when your child becomes sick with malaria, what were the thoughts going through your head as a parent and a healthcare provider? What you should do, where you should go, and how does that help you in the work that you do with your community? How does that motivate and inspire you in your work?
Okay. That time when my daughter was sick, what was going through my head was like, am I going to lose my child to this severe malaria that she has suffered from? Because there are a lot of children that I've seen during the line of my work that died due to severe malaria, that died because they were coming a long way from their homes to come and access the services, but the child just died on the way, even adults just dying. So that was the thought that was running in my head, like, am I going to lose my child as well to this severe malaria? Because I couldn't think straight, even if I was a healthy worker. You know, it's not easy when you are in that shoe, like it's happening to you. But luckily, like I said, I am a healthy worker, and I was just nearby the healthy facility that I had to rush to the healthy facility. And then my colleagues helped out in, like, they did the test. And then after they test, they had to admit her. And after admitting, they administered the treatments, of which my daughter got well, and I still have her up to now. And then during, in this line of my work, I continue doing this work. I wouldn't want to see a life lost from malaria, because we all know that malaria is preventable. So in my line of work, I usually involve myself in that I do healthy promotions give out messages on how the community can prevent themselves from having malaria, so that we should never lose a life to malaria, because malaria is a preventable disease.
Absolutely. So I wonder, earlier you mentioned that the majority of the people in your community are generally illiterate, which is a very common challenge that a lot of healthcare workers have to circumnavigate. And so I wonder, what tools are you using to educate and reach community members outside of the traditional pamphlets and seminars? Because as you mentioned, this is an issue that's affecting, families of, from children to the adults in the home. So how are you teaching people of different backgrounds at different age levels when illiteracy is a challenge that you have to navigate?
Okay, how we teach about community. We have brochures, we have posters that we use that developed in the local language, where people can easily understand, because when somebody sees something, they're able to put it into use. And then the other tool that we use, we do drama in local languages. That is if we are in the communities. But if we're in schools where we know that the literacy levels are like maybe, let me say, in secondary level, we will use English, of course, because they're able to understand English. And then if we're in the community, we use drama, and that drama is conveyed to them in the local language. And we also use the actual audio-visual aids, like the visual aids, like using the actual bed net, like showing them how you can set it up and how they can tag themselves in. And then we also do demonstrations on how they can prevent themselves, like if their surroundings of a breeding area for mosquitoes, we will demonstrate how they can be able to bury the breeding sites. And then also, like in the evenings, what they're supposed to do, like putting on long clothing as well. If they can manage, they should also use mosquito repellents. Those are the methods that we use. Mainly it is in local language, so that we can communicate easily. Yes, and the posters, yeah.
And when you're working with younger people, do you see a lot of children taking the messages home and teaching their families and their parents?
Usually when we have school healthy education, like we go out in schools, when we communicate, like when we give out the information to the children, we usually inform them to go and educate their parents on what they're supposed to do for them to be prevented from getting malaria. And of course, I can't say maybe it can be 100% that all the children will convey the message to their parents, but yeah, a larger percentage usually does convey the message to their parents, because children are always excited when they learn a new thing. They can't wait to go and tell a person about what they've learned. So children are a best media when you really want to convey the information out there.
Yes, they're awesome. And when is generally the busiest time for you of the year when you're working with the community, specifically around malaria? When are you seeing the most cases? When are you doing the most trainings? When are you at your busiest in this work?
Usually, we usually have a surge of malaria cases, usually during the rain season, because we have a lot of stagnant water by then, and that is a media for mosquitoes to breed from. So usually we experience a lot of malaria cases during that time, and usually the clinics are usually outflowing with malaria cases. That is usually most of that time. So we really make sure that by then everything is in place, so that when that person comes, everything is in place, the diagnostics, the treatments are all in place, so that we don't want to lose a life to malaria, because we know malaria is preventable and it's also a curable disease.
Yes. And speaking of that, we know that the Global Fund has provided rapid diagnostic tests, bed nets, and other preventative treatments for pregnant women and other members of your community, children under 5. And these have proven to be transformative in your community and thousands of others. And so we wonder, for you as a frontline healthcare worker, What else do you need to see happen in your community to really get us to the point of malaria elimination?
Okay. So measures have been put in place, of course, on how we can prevent malaria, and then also almost reaching a target where we want to go to a zero or a malaria-free world, or maybe a malaria-free nation like in Zambia. Those measures, yes, are being put in place where, like, Global Fund has supported us in various measures on how we can prevent malaria. So the other thing that I usually want to convey, or maybe that I do not convey, but that I do to my community, like, is the one and the foremost thing is healthy promotion. Because, you know, when you conduct healthy promotion, you are trying to prevent something from happening. So if we do healthy promotion, like we promote, like, how can we prevent ourselves from getting malaria? We won't reach to a point where someone will get malaria, where they will need the diagnostics and also need the treatment. So healthy promotion is the key. And then also social behavioral change, like where people are involved in their behavior, like how am I supposed to behave for me not to contract malaria, for me not to get sick from malaria, how am I supposed to behave? So those are the information that we are conveying into the communities, of which also the community-based volunteers are helping out in conveying those messages. And we are seeing a change, though we can't say change comes rapidly. It is gradual in that eventually we will get there. Everyone will get the answers of them being involved to prevent themselves from having malaria.
Thank you. And behavioral change is such a huge part of global health work. You mentioned the drama classes that you do with the students that teach them things they can take home. I wonder how your work has been impacted in light of COVID-19. Obviously, that required a lot of behavioral and social changes for us to distancing means, learn how to stay inside and entertain ourselves, limiting our access to, you know, the world that we've grown to know. And so how has your work been impacted? Your work, your ability to engage and do advocacy with the community, how's that all been impacted in light of COVID-19?
Okay, with the coming in of COVID-19, my line of work was impacted in that it was like, it was something new that we didn't have a lot of information back then. And even right now, information is still coming in about COVID-19 because they're still doing the researches and the like, of which we are still getting new information every day. At first, we as healthy workers didn't really know what to do, but just to follow the information that was being passed on to us, like we have to mask up, we have to maintain social distance, we have to wash our hands. So those are the information that we were working on. And then, like, in the line of work, it was really difficult, or it's really difficult because we're still experiencing COVID-19. It's really difficult for you, like in case of when you're attending to a pregnant woman. Of course, there is a touch technique where you have to touch the pregnant woman. Even when you're just immunizing children, you have to touch them. And for you to provide that service, you have to be closer to them. You can't manage to maintain the social distance, of which we really didn't know, like, am I going to contract the COVID-19 or what? It was really somehow like, you are just working and praying that it won't happen to you. You won't be the next target of you having contracting COVID-19. And then in the line of work, like in terms of community outreaches, like, yeah, it really impacted because at one point or the other, like some community outreach services, yes, were cut off, not really cutting off, but they were reduced because we really didn't know which way we are supposed to go. Because when you go to the community, yes, there is a crowd that is waiting for you so that you attend to them. You also have to give them healthy talks, of which the social distancing cannot be ideal. So the issue of outreach was really impacted. And then also the other line of working, like people were fearing even to come to the facilities. They would really wait, like they are really pressed, or maybe someone is really sick, for them to come to the healthy facilities. It's like we had cases, like the testings had reduced. For malaria, like people were not really coming in, and then you couldn't even follow them in the community to do the malaria testing, and then also even for the tuberculosis and also the HIV testing, we had just seen a downward trend of the treatments or the testing, which had really impacted on the line of work, because I would say, like, I'm sure lives were lost because of COVID-19.
Thank you so much for sharing that, Mirriam. I'm sure that must have been a great challenge. I wonder if you can give us an update how things have possibly improved today, and how COVID has impacted, the rates of malaria in the community and what you're seeing as a frontline worker in your community today.
Okay. The things have now turned, as in they've really improved, because we have the diagnostics, like for COVID-19, we have diagnostics where we can, rapid diagnostics where we can test and find out if someone has got COVID-19, so that at least treatment is started there and then so that lives are saved. And then really, we as healthy workers are really stressed. Like there's a lot of work out there, like the healthy care system is really strained, in that it's trying its best, yes, to provide all the services. And we are really trying. And yeah, I pray and say that we'll get there if we join hands, like if the local community and the international community come together, we'll join hands. And then it's really turning around, like even with the coming in of the vaccines of COVID-19, people getting vaccinated, of which when you are fully vaccinated, the likelihood of you even contracting COVID-19 are there, but the chances of you getting the severe signs and symptoms are at a reduced rate, of which that one gives us hope, because back then we didn't have the hope because there was no vaccine. But right now we're just hoping that the vaccines will work. And we're also sensitizing our community so that they go for the COVID-19 vaccination, so that at least we can reach the herd immunity status, where like a larger population is protected or is fully vaccinated, so that even if there's COVID-19, it's at a milder rate than it is right now. Yeah.
Thank you. And at the start of this, I read off your list of roles: midwife, administrator, advocate, nurse. And so I'm curious, who is helping you do all this work in the community, all this education and training? Can you tell us a bit about your staff size and just who is involved in the work that you're doing in the community? Who else plays critical roles to support you in all this amazing work that you do?
Okay, this work that we do, of course, we are a group. We've got we are about we are about 5 health workers, yes, at our facility. And we also have got community-based volunteers that just volunteer to come and help out at the facility. They're the ones that help us keep the facility going on, as well as the community services going on. My colleagues, of course, also do the same line of work. Like here, personally in Zambia, like when you're at a healthy facility, like a rural healthy facility, you have to provide supermarket services, where like you have to do all the roles. You can even do the role of a doctor, like as in screening. Yes, screening patients. And then you can also perform the work of a pharmacist, dispensing out medication. And then, like you said, like I'm a midwife, I provide, I'm a counselor, I'm a nurse. Yes, all those I have to provide. And then when you are at the healthy facility, you are trained to provide all the roles, because you never know what service that next person will want, because you just wake up and you don't know what type of services or what type of clients or diseases that you are going to meet. So definitely you just have to be ready to provide all the services. Like if it is the role of a midwife, you attend to pregnant women, you attend to under 5 children, and then you also attend to their partners when they need your services. And then when you are a counselor, you give out information, help people to understand their problem, and then also you help them out to make an informed choice about the problem that they're having. So it's about giving out the information, also you providing the service for you to have a better community, or maybe to have a better Zambia. United States Agency for International Development and also the government of the Republic of Zambia are all jointly involved in training us healthy workers so we can perform the various roles that we perform at our healthy facility. Yes.
And what's something about your community, particularly the role of the health center, that you want the global community to know? Right now, we're speaking to all of our champions, everyone who supports Nothing But Net. So what's the message that you'd like to share with everyone?
Okay, the message that I would like to share to everyone is that we as a community at Kafumbwe Rural Healthy Center, or Zambia as at large, we really appreciate the support that is rendered to us, the needs that we receive, and then also the treatments and the diagnostics. So I would urge you to continue supporting us, continue rendering the aid that you are providing to us, because with the aid that you are providing to us, we are preventing deaths. We are preventing people suffering from severe malaria. And with the aid that you are giving, that you are helping us with, it's helping people to be more productive in their lives. Because if one prevents themselves from having malaria, definitely they'll be productive. They will not miss school. That is, they will not be affected academically, and even due to the fact that my community here, let me say small scale farmers or peasant farmers, where they just they farm enough food so that they can just sell a little bit, have some money so that they can buy some food supplies. So meaning if they don't suffer from malaria, meaning they're economically empowered because of the support that you give, in that they protect themselves from getting malaria by using the insecticide treated nets, and also even if they get sick, the treatments and the diagnostics are readily available. So that is what I would like to convey to the Nothing But Nets champions, that let them continue supporting us and supporting the entire world wherever they can. Thank you very much for the support.
And thank you very much, Mirriam, for being with us today and giving us this time. We're really grateful to have been able to have this conversation with you and hearing from a healthcare worker who is on the ground every day, uplifting and empowering members of our community, who's dedicated her life to the fight against malaria. It's an inspiration to me as a member of the Nothing But Nets team. And I'm sure it's an inspiration to all of our champions who, at various times throughout the year, take time away from their work, from their families, from their school, to go and meet with their members of Congress, to do advocacy and remind our leaders why our work and our commitment to the Global Fund and the President's Malaria Initiative are so important. Because at the end of our advocacy, there are real people who are impacted and supported, and amazing, brilliant, kind hearts like yours, Mirriam, whose work needs to be invested in because they have real outcomes in communities that matter. And so again, we want to thank you. I want to remind our champions to take a moment to pause this video and take a screenshot. You'll go to the STAR report, that's a self-tracking activity report for Nothing But Nets on our advocacy page. And please upload your screenshot of this conversation, of this event, under your webinars, your advocacy training webinars, so that we can see who of our champions has been paying attention, has been attending, and has received this valuable information. So I will stay on for about 5 more seconds. Just pause your video here. All right. And with that, again, we want to thank you, Mirriam. I have one final announcement before we go. This will actually be my final webinar, my last event with Nothing But Nets. When you're watching this, it'll be the 26th. My last day will be the 30th. So if you have any questions, final emails, funny stories you'd like to share, feel free to email me. But I will be leaving
Okay.
the Manette's team at the end of this month, actually to begin law school. And it has been one of my greatest honors and pleasures to serve for the last 3 years as a member of the Manette's team. I've learned so much being myself a Ghanaian. It has been truly so fulfilling to work on an issue that affects people as close as my own parents who battled malaria at various points in their own lives. So it has been an honor, a pleasure to apply what I learned in school to what I've learned in the real world in advocacy on the Nothing Manette's team. Thank you. I appreciate you. I'm grateful to have had these 3 years with you all. And I'll always be accessible and I'll always be in touch. So please keep in touch with me, send us emails, anything you have to ask. Before I go, again, thank you, Mirriam. Thank you, champions. Have a great day.